So typically knee replacement surgery is about an hour and a half experience, and patients are able to walk on the knee right after surgery. Most are surprised to know that they are able to put full weight and begin walking and begin rehab right away. Patients often work with physical therapy the very first day of surgery and are often discharged home on a same-day fashion. The expected recovery is a little bit longer, but in the first 2 weeks, we prescribe in-home physical therapy. That's so patients can work through the walker and the cane and begin early range of motion activities. After that, they go to outpatient physical therapy for about 6 weeks. Expected recovery at about 6 weeks is about 50% overall recovery. 6 weeks is a very functional time frame. Most people have worked through the walker and the cane in the first couple weeks after surgery. Most people are thinking about driving within the first 2 to 3 weeks after surgery. And 6 weeks is also the time where most people are looking to get back into work. Some jobs do require some work hour modifications and some work restrictions, which is something that I'm happy to provide for the individual patient. Continued strengthening continues over the course of many months. At about 3 months from surgery, most folks are about 85% recovered, and most people do continue to report strength and stamina gains for up to a year.